Hi, Miss Violet. I just wanted to come check on you, see how you were doing tonight, and let you know that tomorrow at 9 a.m. they're going to be doing SIBR on you. So what that is the physician and the nurse practitioner come to your bedside to talk to you about what's been going on since you came in the hospital and what the plan is. Do you have any concerns that I can help pass on to them tomorrow so that we can make sure we address that?
Yes, I'm having some pain, and I noticed earlier I didn't have much of an appetite.
Okay. What is your pain rating right now?
It's about a 6 right now.
Okay. So we have some medicine ordered for you for pain. So I'll make sure to bring that in and we can see how that works. And then tomorrow we'll review your pain control and your appetite and see what else we can do to help you.
Okay.
Good morning, guys.
Good morning.
Are you ready to SIBR on Miss Violet? Yes.
Yes.
Okay, so just to go over her safety checklist, she does have a 16 French Foley that was placed in the ED yesterday. I was wondering on plan for removal, possibly today.
I think the ED placed it due to her immobility initially, so I'm sure it's fine to come out today.
Okay, she does have an 18 gauge IV in her right arm that is functioning without any issues. For blood clot prevention, she is taking the sub-Q heparin without any issues.
Good.
No skin breakdown, skin's intact.
Good.
She's currently stepped down with telemetry. I was wondering if that could possibly be downgraded today?
I think so.
Yes.
Based on chart review, vital signs are completely stable. I definitely think she can be downgraded.
Okay.
And this is her first SIBR, is that
Yes,
right?
she is. We talked to her about it last night, but this is the first time actually doing the SIBR runs.
Okay, all right.
Great. Good morning.
Good morning, how are you today?
I'm well, thank you. You must be Miss Violet.
Yes, I am.
Wonderful. I'm Dr. Pablo Bedoya. This is Nurse Tabitha.
Hi, good morning again.
Nurse practitioner Allison Gordon.
Good morning.
We are your team. And together we're going to do the structured interdisciplinary bedside rounds. So take it away, Nurse Tabitha.
So we talked about your happenings from overnight. You didn't have any acute changes. You did have an input of 3,700 and an output of 1,875 from the Foley. You are still getting hydrated with the IV fluids at 125 an hour, and you did have one bowel movement that was normal. Discussing your concerns, the major ones were just pain control and your right side of your back. They started you on the oxycodone last night.
Yes.
However, you were still a 6 for pain, and your goal that you'd be comfortable with would be a 2. You also voiced concerns of having a poor appetite as well.
So we have a few clarifying questions for you. Does the oxycodone actually help your pain at all?
A little bit, yes.
And when you do have pain, are you having sharp pain or is it dull?
It's dull.
And is it constant or intermittent?
It's constant.
Okay. And were you able to take more than half of your dinner last night or less than half of your dinner?
Also that's.
Okay.
Okay.
Okay, all right, that's fine. So we're gonna examine you unless you have any other questions you wanna ask before we start.
Your appetite should get better as we treat your urinary tract infection, so I think everything's fine.
All right, let's close the door. We'll have a listen first. Just breathe normally. We're gonna move we're gonna recline your bed, okay?
Okay.
So just a second. You can lie back. I'm gonna push on your abdomen. You tell me if it hurts,
Okay.
okay? Does that hurt? Does that hurt? Does that hurt?
Just
A bit? How about there?
a little bit.
How about right there?
A bit.
How about there? No? So mostly a little bit here and some here, is that correct? Okay. Wait, just a second, sorry. Does that hurt at all? No? How about that?
A little.
How about that?
A little.
Okay. Let's set you up. Thank you. I'm going to palpate your back, okay? You tell me if it hurts. Does that hurt?
No.
Does that hurt?
A little.
A little bit? Okay. How about over here? Does that hurt?
No.
Okay. We're gonna listen to your back. Take a deep breath and out through your mouth. Again. Again. And again. Good. So your lung sounds were normal. Your abdominal exam was just remarkable for basically a little bit of tenderness on the right lower part of your abdomen and right over your bladder, as would be expected with someone that has a urinary tract infection. You had a little bit of tenderness in your right lower back as well, but it wasn't as significant as I would be expecting in someone that has a severe kidney infection. Okay? So let's talk about your assessment and plan. All right?
So we're gonna get your Foley catheter out today. We are gonna change your antibiotics over to a pill antibiotic that you can swallow and you can take it home. We'll see how you do with lunch, and then make sure that you're voiding after your catheter comes out.
Okay.
And then we'll see about going home after lunch today.
All right. That sounds good.
You ever have any trouble getting your prescriptions filled?
No.
What pharmacy do you use?
CVS.
Okay. Do you ever ride home and
Yes.
everything? Okay. All right. Well, you just let Tabitha know how you're doing throughout the day, and we'll try to get you home today if we can.
All right.
Does that sound good?
Yes.
Okay.
Thank you.
Just remember, you do have to eat and you do have to urinate on your own before you leave.
Okay.
All right?
All right.
Have
Take
any
your
questions for us?
All right then.
Well, it's nice to meet you.
Thank you so
You
much.
take care.
We'll be back to get out the Foley.
All right. Thank you.